The newsday continues here on One News Now. I'm Riza Diaz. The Health Department reports over 1,900 new COVID-19 infections. That brings the country's caseload to above 535,000, nearly 36,000 of which are still considered active. Around 95% are asymptomatic or mild cases. The virus killed 55 more patients in the past 24 hours, pushing the death toll to over 11,000. Now, some 488,000 meanwhile have gotten better from the disease, with 52 recoveries reported today. The DOH also confirms 8 additional cases of the UK COVID-19 variant in the country, bringing the total number to 25. The Health Department has yet to confirm whether there is already community transmission of the UK variant here in the country. Health Secretary Francisco Duque III said community transmission happens when there are large clusters of cases in different areas. As of now, he says what's happening may still be local transmission since cases can still be linked to the index case. The department is still waiting for the full epidemiology report on the new COVID-19 variant cases.
Pwede natin may local transmission, but not yet community transmission. Because pagka sinabi mong community transmission, ibig sabihin you have large number of cases. Large number of cases you cannot link to an index case. Hindi mo or link to a chain of transmission.
Now, to shed light on this matter, joining us this evening is Health Undersecretary Maria Rosario Vergere. Ma'am, good evening.
Good evening, ma'am.
Thank you for joining us this evening. First, let us clarify what is a local transmission and how is it different, ma'am, from a community transmission?
Yes, when we say it's local transmission, it means that you can still identify the index case and you can see the linkages of the different cases in the community. Now, if you say it's community transmission, you cannot identify anymore any linkage of these cases that are happening, or the index, you cannot find the index case anymore. So it means that the transmission has been widespread already.
Mm-hmm. So how can we say if there is already a community transmission in a certain area, and are there criteria that are we looking for?
Oh, well, of course, we have to look at the, we have to find the index case or the source disinfection. So, for example, what's happening right now when we identify or detect somebody who has the variant, we have to do contact tracing and try to find from whomever this case or this variant, this individual who has the variant, where he got this infection. So that is the basic criterion for that. If we will not be able to find anymore, let's say, for example, an individual never left his house and then he got positive, and then in the community you cannot find anymore an index case who had been in contact with this person, and there are still other people who has the variant or has been detected with the variant in the community, and maybe that's the time that we can say that this is really community transmission already.
Yusek, so there is local transmission and then there's community transmission. Are there other levels beyond community transmission?
Well, community transmission is the highest level according to the levels of WHO. So when it's community transmission, as I've said a while ago, it means that the infection is already widespread in the community.
I see. Now, a research group we interviewed earlier, Yusek, said that the recent surge of infections in Cebu, plus the confirmation that there is indeed the B117 variant in the province, could mean there's already community transmission. Would like to get your reaction on that statement.
Well, for now, nothing is certain. We cannot definitely say that there is already community transmission. We can see that the cases are rising or increasing, but there would be a lot of factors that can contribute to this increase in the number of cases. But of course, there would always be that possibility that there is this transmission ongoing in that specific area. That's why we are trying to investigate properly.
Mm-hmm. Yusek, will the health department also be recommending changes in protocols should we find local or community transmission in these areas?
Actually, as we always say, there has been no major changes in the virus, even though that there are these variants. So the minimum public health standards and the other health protocols remain to be the same, and we are not going to change it. Although, what we are saying, we need to strengthen what is the existing protocols that we have so that we can further prevent the spread of these variants. And one of the things that we need to do really is to do surveillance. And we are already doing that, but we need to expand it and we need to strengthen that. Another thing would be that the local government should be able to strengthen their isolation and quarantine and testing procedures so that we can be able to detect properly and immediately, and we'll be able to prevent the further spread of this variant.
Yusek, still on the protocols, your thoughts are our current border measures, the ones that we are implementing right now, enough for the arrival of more foreign nationals come February 16?
Well, it has been decided by the Interagency Task Force, and when they decided on this, there were evidences that were presented, and they have weighed in on this, and the experts also have had their recommendations on this. Specifically, these border protocols now that we have would be that we are going to test more appropriately because we are going to test on the ideal day where the virus, if ever, would be more detected, no? Rather than before, when they came, they are tested, and most of them would turn out to be negative, but when they go back to their local governments, they become positive. So we have changed that, and we are expecting that the local governments also would strengthen their quarantine and isolation protocols, that when the individual gets to be endorsed to the local governments, they will comply strictly to this 14-day quarantine period.
Well, thank you for your time and for your insights. That was Health Undersecretary Maria Rosario Vergere. And we'll be back with more stories after the break. Keep it here on One News. You're still watching One News Now. I'm Riza Diaz. One person died while 4 were reported injured in a fire at the Lazada warehouse in Las Piñas City this morning. According to the Las Piñas City Police Station, the fire broke out at around 7:54 in the morning at the ground floor of the warehouse and reached second alarm. A 25-year-old Lazada employee who was reportedly trapped in the facility died of the incident. Authorities are still investigating the cause of the fire and total damages. The Government Service Insurance System, or GSIS, has enhanced its pension loan program. GSIS Core Business Sector Executive Vice President Attorney Nora Malubay said the enhanced pension loan will increase the maximum loanable amount to 6 times the monthly pension. Pensioners can now loan up to a maximum of 500,000 pesos regardless of age. Malubay said it is possible to finish the entire process within the day using the GSIS kiosk as they continue to fix their online system.
Ang enhanced pension loan po, dito lamang po sa head office ang po pwede pa ho through the kiosk, kaya napakabilis lang po nun. Within the day po yun na i-credit na po sa UMID e-card.
Now, here are other stories we're keeping our eyes on. Senator Ping Lacson says the conviction of pork barrel queen Janet Napoles would not be enough to stop similar corrupt activities from happening unless certain punishments would be imposed. Lacson noted that even the Supreme Court ruling that outlawed pork barrel in 2013 did not manage to stop the practice. Napoles and former Cagayan de Oro Congressman Constantino Araula were found guilty with 3 counts each of graft and malversation of funds. Senate Committee on Basic Education Chairman Win Gatchalian is opposing the proposal for a no-fail policy in the current academic year, saying it may do more harm than good. Gatchalian said learners who will be allowed to proceed to the next grade level without proper assessment of their weakness may continue to underperform in the long run. And Senator Amy Marcos is calling out the so-called double standard in enforcing COVID-19 pandemic control measures. Marcos' statement comes after the government allowed state employees on official trips to skip testing and quarantine. The lawmaker explains that the move will just make it more difficult for local government units to control the spread of COVID-19. Now, for more updates, visit News 5, The Philippine Star, and Business World Online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. I'm Riza Diaz. We are One News.